Alright, so first my environment check. I have a tower here. I'm going to do my brain dump on. Alright, so I'm going to begin. Good. Privacy. My name is Kira. I'm going to be your nurse today. Right hand hygiene. Can you remember your date of birth? Caitlin 3643. Your last name? Forgani. Awesome. Do you have any allergies? None. Okay, I'm going to put in the bracelet. Okay, awesome. So today I'm going to wear gloves for this assessment. So first I'm going to ask you a few questions. Or are you in a comfortable position? Mm-hmm. Do you have any questions before we get? It's going to take about 15 minutes. I'm just going to take a look at your head, eyes, ears, nose, and throat. Okay. So have you had any concussions? No. Do you get headaches a lot? Mm-hmm. Have you noticed any balding? No. Okay, so first I'm looking at her head. I'm looking at the placement. It's midline. It's symmetrical. Her head is a good size for her body. It's round. So next I'm going to look at the hair. I'm looking, her hair is brown. I don't see, like, distribution is good. There's no bald spots. Her texture is thick and soft. I'm looking for any infestations. If you don't see any lumps or bumps or tenderness, let me know. I don't feel any lumps or bumps. Her hair is nice and long and thick. Alright, so next, I'm going to move on to your face. Do you have any problems with dry skin? Oh wait, I don't have to ask you questions for the face, so I'm not going to do that. Okay, so I'm going to have you smile for me. I'm going to do the facial nerve right now. Frown, raise your eyebrows, puff out your cheeks. So I'm looking at both sides are symmetrical and evenly distributed. They are. Both sides of her face are. There's no drooping on either side of the face. Next I'm going to test her trigeminal nerve. Maybe close your eyes and tell me where I'm touching. Forehead. What side? Left. Right cheek. Left cheek. Right forehead. Nose. Awesome. So next I'm going to move on to her eyes. So I'm looking, look straight at me. Her pupils are even, her irises are even. They're looking straight forward symmetrically. Her eyelashes are evenly distributed. They're the same on both sides. There's no balding. They're thick. They're brown. Her sclera is white. Her iris is blue. Her pupils are black. Can you pull out your conjunctiva for me? Her conjunctiva is pink and moist. Her eyes are moist. There's no drainage. You can put it back up. I'm going to palpate her lateral ducts, globes, and just around her eyes, making sure there's no lumps or tenderness or anything. Let me know if you feel any tenderness. Nope. There's no lumps or bumps. The contour is good, and there's no lag in her eyes. So next, I'm going to have you look at this. I'm doing pupil accommodation. I'm going to have you look straight forward when I move this. Awesome. So I'm looking that her eyes do dilate when I remove the pen, and they do. I'm going to look in the eyes, looking at the cornea and the lens for any lesions, which there are not. I'm not seeing any. Next, I'm going to have you hold this out an arm's length away from your face and read the orange. Adult, non-sterile. Awesome. So now her pupil size is a 6, which is good. We want to see it between like a 4 and a 6, so that's good. Her iris is a 9, which is also good. Next, I'm going to test her abducens, oculomotor, and trochlear cranial nerves I'm going to have you follow this pen. Her eyes are moving together and they're not shaking at all, so that's good. That's what we want to see. Next, I am going to test her peripheral vision. I'm going to have you close one eye, yes, and tell me when you see this pen. No. Awesome. Oh, yeah, other eye. No. So, just in case I forgot to do hand hygiene at the beginning, because this was my second try, I would have done hand hygiene. Okay, so I tested peripheral, I tested cardinal gazes, and now I'm gonna have you look straight ahead and cover one eye. Then I'm looking at the reaction of your pupil. It is constricting. Good. Cover the other eye. Awesome. And then I'm gonna have you not cover, and I'm gonna look at the other one while I'm looking at. I'm gonna shine light in one and look at the other. Make sure they work together. They're constricting at the same time. Yes. And yes. So everything looks good there. So next I am going to look at your nose. So it's symmetrical. The color is the same color of the rest of her skin. I don't see any lumps or bumps. I do see that she has 2 piercings. I'm going to ask you 3 questions about your eyes. Do you wear glasses? Do you have any injuries to your eyes? Nope. And do you have dry eyes? No. Okay. So I would have done that before I do the eye assessment. Now I'm going to do the nose questions. Do you have bloody noses? Yes. Do you have drainage? Yes. Do you have any issues smelling? Nope. Okay, well first I'm going to test her olfactory nerve by close your eyes, plug a nose, nostril, and tell me what that is. Alcohol. Good. Other nose. Alcohol. Good. So her patency is good. Or can you do that again and? Yep. Breathe in both sides. Awesome. So her patency is good. Her olfactory nerve is intact. So now I'm going to look for drainage. I'm gonna have you tilt your head back. So inside of your nose, there's no redness or irritation. There is a little bit of some flutter in there. The contour is good. There's no blockages, no drainage, bleeding, anything like that. I'm going to palpate your maxillary and frontal sinuses. Just let me know if you feel any pain or tenderness. Temporal, maxillary. Okay. I'm going to palpate your temporal mandibular. I'm just going to have you open up your jaw and move it to side. So there's no signs of crepitus and it's symmetrical. There's no pain when I touch that.
Nope.
Okay. So next I'm going to move to the ears. I'm looking at the outside of the ears for symmetry. They're symmetrical. The skin color is good. It matches the rest of the body. The size of the ears are proportional to her body. There's no drainage that I can see. There's no redness, anything like that. I'm going to ask you 3 questions. Have you ever had tubes in your ears?
No.
Have you had ear infections? Do you have any tender ears right now that you can? She has earrings in, I would note. I'm going to palpate your tragus. Let me know if that hurts. No. Fold her pinna. Hold back. And out. No, so nothing hurts. I'm doing okay. So now I'm going to look in her ears. Pull up and back. See you tomorrow. Making sure not to go far in. We do have some rumen in there. There is a gray, really gray tympanic membrane. There's no infestations, no redness or swelling, indicating infections. No blockages. Overall, her ear looks good. Over here we have some rumen, gray, pearly white, tympanic membrane. There's no infestations. There is a normal amount of rumen. There's nothing concerning. There's no redness or irritation, anything like that. I'm gonna throw this piece away. Next, I'm gonna do a hearing test. I'm gonna do a whisper test. So I'm gonna whisper a word in your ear and just repeat it to me.
Leave. Books.
Awesome. So the hearing is fine. And her ears look good. So next I'm going to move on to her mouth. So first I'm looking at her lips. Oh, I would also look for edema in her eyes. Can you close your eyes? Which there isn't any edema at all. Yeah, so now we're gonna look at the lips. The lips are very dry and cracked. I'm gonna palpate them for any lumps or tenderness. Let me know if you feel any of that.
Nope.
Okay, I'm gonna pull out your lip. Palpate it. Any lumps, bumps, or tenderness?
Nope.
Alright, and your upper lip. Okay. So now I am going to change my gloves. But okay, so I'm gonna have you open your mouth and I'm inspecting your tongue. It is smooth, it's pink, there's no discoloration or weird drainage. I would palpate it on both sides, kind of just like this, for any lumps or bumps or tenderness. Her both buccal mucosas are moist and pink. Again, no drainage, no sores, lesions, anything like that. I see her teeth are good. They're well distributed. She has 24 of them. They're taken care of. How many times do you brush your teeth a day?
2.
Do you have any issues swallowing?
Nope.
And do you have any sores in your mouth?
Nope.
Okay. So I'm looking at the bottom of her mouth. Open your mouth, please. Under your tongue. Yes, I'm looking there. The coloration is good. It looks healthy. It doesn't look irritated at all. Looking at her hard and soft palate. Give your tongue down, please. Okay. Her uvula is symmetrical. Use my tongue depressor to look at her mouth better. Okay. So her tonsils are good and symmetric. There's nothing coming out of them. No excretions. They're a good size. They're small. Soft palate and hard palate look good. They're moist. The whole mouth is moist and pink. I'm going to test the gag reflex by pushing my thing back further. Can you say light, tight, dynamite?
Light, tight, dynamite.
And I just tested the hypoglossal nerve. Can you swallow for me? Good. So I would also palpate her hard and soft palate. Just kind of, I would have to probably use just a couple fingers in there because it's not going to be very comfortable for the patient. Alright, so I believe that is it for the mouth. Next, I'm going to move on to the neck. So first, I'm going to palpate for any tenderness or sores, anything like that. No. Posture is good. Midline. Her neck is symmetrical. It's a good size for her body. I'm gonna have you just follow my movements with your head. Some range of motion. Good. So now I'm going to just feel for any tenderness. We have a preauricular, postauricular, supraclavicular, deep, let me try that again. Preauricular, postauricular, posterior, or anterior cervical, posterior cervical, deep cervical, supraclavicular. And I'm going to have you stand up for me. I'm going to perform the Romberg's test. Yep. Stand with your feet together and just close your eyes. And I'm just looking for a swaying, which she's not swaying an odd amount. So that test would come back negative. You can have a seat. I'm going to palpate your thyroid for any lumps, bumps, or tenderness. Your submandibular, your submental, your tonsillar, submandibular, submental. Alright, so I believe that sums up my assessment today. Do you need anything before I go? I have time?
Nope.
Alright, so I'm going to make sure the bed is down, low, and locked. Side rails are secure. Bedside table is within reach. Call light is within reach. There are no obstacles that the patient could trip on. Provide hand hygiene. I would clean any supplies. But I don't have any to clean because I threw away the popsicles or the tongue depressor. So I'm gonna thank my patient for my time.
You're welcome.
Document. Exit providing privacy.